We're going to be talking about the Titleist Performance Institute. A little bit of background about me. Growing up, I was always involved in athletics. Kind of started in soccer there, so I played in high school and played in college. And when I got out of college, I started playing in an adult men's league. And saw some of my friends actually getting injured. One guy actually broke his leg, and another guy fractured a bone in his elbow. So ever since then, I was like, well, maybe I need to kind of rethink me playing soccer as I get older. I started playing a lot of golf actually with my friends. A lot of my guys I played soccer with in college, and fell in love with the sport, fell in love with the game, and I do treat a lot of golfers in the clinic as well. The more golfers I saw, I thought, well, wait a second, there got to be a protocol to kind of get people back on the course so they're feeling 100% of their game. And so there's something called the Titleist Performance Institute. And I actually got certified through them about 3 years ago. And long story short, what the Titleist Performance Institute will do, it basically just, if you're in any kind of pain, it's going to get you out of pain. And I always tell people results vary. I'm not guaranteeing that you're going to be shooting anywhere from like a 90. Now you're going to be shooting in the 70s. But we are basically trying to increase mobility in certain muscles and joints that need to be mobile during the golf swing. And then we're going to give you exercises to increase stability structures during the golf swing, too. This is very, very fun for me. I mean, shoot, in the spring and the summer, I try and golf 2, 3 times a week if time allows me. And so we're just going to dive right into it. And there's a little bit of background about myself. And so about the Titleist Performance Institute. They studied thousands of golfers, anywhere from amateurs to actually PGA Tour professionals, and basically they gathered data on every type of player. It didn't matter your size, shape, age, fitness level, and basically on the data collected, they come up with their how to properly use your body so you could swing a golf club the most efficient way possible. And that's just a picture of over the Titleist Performance Institute. They'll actually hook people's up to sensors, and then you can kind of get a kinematic sequence. TPI's mission is to educate golfers on the body swing connection. And where I come into play as a level one provider is we analyze physical limitations you have that can adversely affect the golf swing and lead to a potential injury. And I'll kind of just start off by saying the number one guy in the world right now, John Rahm. If anybody watches him, his golf pro, that's actually the guy who trained us. He had a club foot. He was born with a congenital abnormality. He had a club foot. So if you actually watch him, and if you watch his footwork, his ankle, it isn't the classic golf swing, so to speak. How that works is if you had any kind of lumbar fusion, if you had any kind of cervical fusion, neck surgery, any knee surgery, or any kind of just pain or any kind of tear and prior injury, basically we have to assess those and see what structures are going to get taxed more for you to perform your golf swing. All right, and the philosophy is the TPI believes golfers will benefit the most from a healthy and efficient body. And the most efficient swing is not the same for every golfer because of efficiency is unique to your body. So, for example, if you watch a guy similar to my size, 5'8", I'm not going to swing the same as a guy who's 6'1" or 6'2". There's different biomechanics that kind of come into play there. In the TPI screen, it basically does an assessment of not only your swing mechanics, biomechanics, so how well your body's moving, your physical fitness level, the movement quality, your current health history, and then your prior health history. Again, if you had any kind of surgery that's going to impede, if you don't have the full range of motion in a specific joint, or if you're just not mobile through certain muscles, that could definitely affect your golf swing as well, and then lead to a potential injury. All right. So this is probably my favorite statement. The TPI does not believe in one way to swing a club, rather an infinite number of swing styles. Can't stress this enough. Sometimes when you go to a golf pro, they basically say, oh, well, you got to do it this way, you got to do it that way. Where we come into play is we actually see how your body functions and then come up with a swing style, exercises, and stretches that are tailored towards you so you don't have a potential injury and you could get the most out of your body. Where I see the most results is not only getting people out of pain during golfing, but usually people are going to increase their distance just because we are basically giving them different stretches that you could do to increase mobility in certain muscles and then stabilize structures that need to be stable during a golf swing. So uh, what we do believe is there one efficient way for every player to swing, and it is based on what the player can physically do. Kind of reiterating. And once the screen is finished, there's results, and actually, there's a printout copy, and there's a whole thing on an iPad you do, and it comes out with basically like a prescription, you could say, of different exercises you could do, stretches you could do pre and post round, just to maximize your full human potential of swinging a golf club. And these range depending on the person. This could go anywhere from fitness training, treatment, which is what I do, physical therapy, nutrition, and coaching of the biomechanics. All right, so getting into the TPI screen, one of the biggest things is mobility. So mobility, the definition is the combination of normal joint range of motion and proper muscular flexibility. This is absolutely vital for biomechanics and injury prevention. And right here we have Dave Phillips. This is one of the big guys in TPI. So you see him going into his backswing, a right-handed golfer. So we'll go into this a little bit later, but um, basically it points out the left cervical rotation you got to have in the golf swing and the right thoracic rotation. So if you are limited in one of those motions, that is going to throw off your golf swing right away, and you're not going to be able to maximize your full potential of swinging a golf club. Um, so mobility allows the generation of elastic energy between muscles and therefore establishes a base for efficient power production. So if you aren't mobile due to you sit a lot at work due to being inactive, any kind of prior injury, stress is going to be loaded to adjacent structures in your body, which again can lead to a potential injury, and you're just not maximizing your golf swing. And then now, where this comes into play too. So mobility and stability. We'll dive in a little bit more. This picture's crazy. I thought this was just Photoshop. This is a real picture. This was in the Golf Digest. This is Dustin Johnson taking a backswing by balancing on an exercise ball, which is pretty darn impressive. So stability is the ability of any system to remain unchanged or unaligned in the presence of changing or outside forces. So it's the ability to keep one part stable while stretching other structures. A good analogy with this is like a bow and arrow for any hunters out there. If you're drawing your arrow back and you're shaking like crazy, you're probably not going to get a look at your target, right? So you have to keep everything stable while you draw back your bow, just so you could get the result that you want. Same thing happens in a golf swing. If you are not stable through your lumbar spine, and when you go to go through your backswing and you're kind of swaying, shifting, gliding, everything like that, you're definitely going to have a potential injury, and you're just again not maximizing what you can out of your golf swing. So stability is basically created by combining three things: balance, strength, and muscular endurance. And we'll kind of dive into that a little bit more here. So this is they say the normal pattern here. So when we were talking about John Rahm, the world's number one, since he has actually a clubbed foot, he has to tweak his golf swing just because he's not able to do your quote unquote cookie cutter golf swing here. Um, and so how it works from the ground up is foot supposed to be stable, ankle supposed to be mobile. That's why the cool thing about TPI is you go through the 16 main biomechanical movements in the golf swing, analyze them, and then we're basically going to see where you're deficient. And we work literally from foot all the way up to your neck. Neck's a lot more important than you think. If you don't have good rotation of your cervical spine, a lot of times when they go up into the backswing, you're supposed to keep your head down, and their head wants to come up because they can't keep their head down over the ball. So this is kind of just the normal breakdown pattern of going through basically the biomechanical movements during the swing. And limitations in mobility can predict instability. Can't stress that enough. And that's exactly where I come into play because I am a chiropractor, but I also went for a master's in sports rehabilitation. So I do a ton of soft tissue work, massive in golf, right? So the three main things that could lead to instability if you have a lack of mobility. The first one's called reciprocal inhibition. And that basically is just a phenomenon that occurs when a tight muscle basically decreases the functional antagonist. What does that mean? We're going to slide forward to something called lower crossed syndrome. Very common in people that are basically sitting 40 hours a week working. So what happens is in the lower cross syndrome is you're going to have weak abdominal core, and you're going to have a weak glute max, and in turn you're actually going to have tight thoracolumbar extensors, those are called your erector spinae muscles, and tight hip flexors. Most everybody sitting working from a computer all the time are going to have the tight hip flexors and the weak glutes. So that is the reciprocal inhibition. You have a discrepancy between an agonist and an antagonist muscle there. Synergistic dominance basically means that if you're using the same muscles to perform a movement, if one is a little bit weaker, then a synergist, kind of like a helping muscle or a stability muscle that shouldn't be helping, actually kind of turns on to kind of help perform that movement, and that could definitely lead to some instability as well. The last one, arthrokinetic inhibition, basically talks about the joint. If the joint is not functioning properly, you're not going to get the full range of motion that you desire. And that is exactly where we come into play as chiropractors, me and Dr. Orbach here. All right. And so this is Will Zalatoris. This was actually during the BMW Classic last year. This was the FedEx Cup. And this is his chiro actually working on him. And they later disclosed that he actually had an L5 S1 disc bulge. And so basically, muscle balance can cause a ton of different things. So overuse of tissue leads to shortening and tightening of the postural muscles, and disuse leads to a weakening or inhibition of the phasic muscles, the ones you're trying to use. And how the imbalances can occur, just like we were talking about. If you're in a seated position 40-45 hours a week, you're going to have that lower cross syndrome, so your glutes are going to get weak, and then you're going to have a tight iliopsoas or a hip flexor. Standing for a long time and repetitive movements. A lot of times people come in, if we do the TPI screen, they're like, Doc, I'm pretty active. My line of work, I'm kind of a blue collar guy. I'm out, I'm moving and grooving, doing manual labor. Depending on the line of work you're in, sometimes you still might have a deficiency in mobility. Lack of movement and obviously sedentary lifestyle as well will cause the muscle imbalance. So, going back to the lower cross syndrome, a lot of people have lower cross syndrome. Me and Dr. Orbach see this all the time. And in the room, basically what I do, just kind of take you inside the room here. We're talking about the weak abdominals and the weak glute max. So what we'll do is we'll actually go through a full exam with you, and then we will give you the correct exercises based on your body to kind of increase the mass, and basically to fire the glute max and fire the abdominal core. So one of my favorite core stability exercises is a dead bug. I think everybody should do that daily. The reason why the dead bug's so important is because your spine's neutral in it. So a lot of people, when they go to the gym and they want to say, "Oh, I want to get ripped. I want a six pack." Everybody wants to do the Romanian chair sit-ups, hanging windshield wipers. Yeah, you're going to get cut, but at the same time, you're actually compromising your lumbar spine because your core muscles are actually a stabilizer muscle. So why not train them with a stable spine? So dead bug's a great one. A bird dog's fantastic. Palloff press, and then your front and your side planks. Those are probably the best core stability exercises to kind of get that turned on. And then we also give exercises that you could do at home. Very, very simple to increase the strength of your glutes. Pivotal in a golf swing for sure. And then the same with the tight thoracolumbar extensors we were talking about. Those are called your erector spinae muscles, and the tight hip flexors. There's very, very simple stretches that you could do, and then not only to stretch to kind of loosen up the tight hip flexor, but then to engage it. So we'll go over different corrective exercises you could do as well. All right, and leading into the upper cross syndrome. So same thing. People were sitting for prolonged periods of time. What happens is, and this is called the C posture. So I could kind of give you guys a side view. So during the setup of a golf swing, the first movement that the TPI stresses is basically your setup posture. So it's like you're holding a 5-iron. You get in your 5-iron stance, and your C posture is basically when your back kind of concaves like this. So your setup is a little bit more rounded like this, opposite of the S posture. So the S posture, think Beyonce butt. Everybody's pushing their butt out and they're trying to create a big arch in their back like this. So the upper cross syndrome, you're usually going to have a C posture, and that's just going to load different, basically different joints and different muscles, and it's just not efficient in your golf swing. So if you're coming in with the upper cross syndrome, so the weak, deep neck flexors, and the serratus muscles, your rhomboids, and also your erector spinae and your thoracic spine, we're going to basically give you exercises to kind of turn those on and basically facilitate those movements. And then we will basically give you stretches, and we'll provide therapy in the room to release the tight pecs, the upper trap, and the levator scap. Again, a lot of people sitting in a fixated position for a long time, working from a computer. What happens is arms are out in front, and then your shoulders want to roll forward. Your neck wants to follow suit. So what we actually do in the room is we do something called a active release technique, and we're basically trying to shorten down the muscle, pin it, and stretch it back out just to make it a little bit longer. Pec minor's massive in that. So over time, with different exercises that we could give you stretches, and then the therapy in the room is we're going to get your shoulder from being in that forward posture to kind of drop back, and that will in turn have your head kind of fall back so you're not in that anterior head carriage. um, and this basically just talks about if you're set up in the C posture, that's lack of thoracic spine extension. So basically leaning back like this, lead to a severe loss of spinal rotation, which in turn is going to basically limit your ability to go through your backswing. All right. And so they did this. We were talking about anyone from like the weekend warriors, amateurs, and then the PGA Tour specialists. The main things that they were seeing in this the TPI screen was 64% of people were losing their posture in early extending. So what early extending means is basically when you're going to swing a golf club, your butt kind of goes back, goes forward like this, and you're putting your lumbar spine in a very compromised position there. So um, just a fun fact too: the most common parts on your spine that are most susceptible to injury due to loss of posture or early extension is going to be your L5, S1, and your low back there. That is very, very common for golfers to have an injury there. A lot of my golfers that I see are either coming in with a low back or your quote unquote golfer's elbow, that medial epicondylitis, and we'll kind of dive in how I treat that in the room. So this was kind of just like the main ones they found statistic wise after basically screening thousands of players. And then the Big 12, so we were talking about. So that's Dave in the background, and these are basically no-nos that you don't want to do. And there's 12 main ones that a lot of people do. So we were talking about your setup posture. So depending on your body type, right? If you are a taller guy and you have two small clubs for you, you are going to be set up in that C posture, and you're just completely killing your thoracic mobility, so you're not going to be able to go through the backswing as efficiently as you would. S posture, similar thing, but it's actually going to be lower down in your spine. So when you set up in your S posture, instead of setting up just like you're addressing a ball, you're going to have an accentuated curve of your low back, and that's basically just going to load those facet joints and the disc in your back, and you're going to have problems down the road for sure. Loss of posture is basically that could be shoulder mobility or actually lat mobility. When you go up to a full backswing, if you're just kind of losing your posture there, it's going to load different structures, flat shoulder plane, early extension, and then the list goes on there. And there's the references. So basically what we do when we're in the room is there's 16 main movements that we do, and it literally goes addresses from the setup posture all the way to your wrist too. So if you had a wrist injury, or if you electrician, you've been using tools your whole life in that line of work, and your wrist just isn't mobile as it once was, that could definitely affect your golf swing. So we are going to address basically from foot all the way up to your neck, where you're moving well and where you're not moving well. And if you're not moving well in certain ranges of motion, or if certain muscles, tendons, and ligaments are tight, we're basically going to do therapy in the room to kind of address that, and then we're going to kind of correct your posture when you go through the golf swing. So this was pretty darn fun for me, just because it's different than what I'm usually doing in the treatment room. But I do see, like I was talking about earlier, low back's probably the most common one. And this is my first rodeo. We've been doing this. I actually have a couple D1 golfers that I work with, and then just weekend warriors. And it is very, very fun when someone comes in and they're like, "Doc, I wanted to play 36, but I can't. Once I get around like the hole 12 or 13, my back starts irritating me, or my elbow irritates me. But last weekend I played 18, and then actually Sunday I went out and played 18 too, and I was completely pain free." That's what I love to hear. And again, results vary. If you shoot it in the 90s after you get screened, and after we give you some exercises and some swing tips, you're not going to be shooting in the 60s. Unfortunately, I wish that was the case, but that is definitely not the case there. Um, so we'll just give an example of what we could do. Very, very common if you've ever heard of golfer's elbow. So golfer's elbow is basically medial epicondylitis. So basically what that means is you have tight muscles in your forearm that are attaching to your bone called your medial epicondyle, and a lot of golfers actually get pain right here. It's funny though, because golfer's elbow is on the inside, tennis elbow, lateral epicondylitis on the outside. It's kind of a coin flip. Some people are actually coming in with pain on the outside, so kind of having that tennis elbow symptom, but we kind of treat it one and the same. Obviously, different muscles involved, but what we do in the room is first thing is we got to get you out of pain. So we have a class 4 therapeutic laser that we're getting crazy results with. And so what the laser does is it works on a couple different components. So um, my best laser spiel in a nutshell, I'll keep it to a minute. Just how sunlight hits a plant for a plant to grow and heal. We're donating photon energy to your cells, so you could basically heal 100 times quicker than what you normally would. And there's a couple things that go into play there. So during the laser therapy, it allows for increase of nitric oxide and O2 perfusion across the cell membrane. So basically, it's going to bring all your body's blood and natural stem cells to the area to heal, and it'll also facilitate the delivery of oxygen to the area as well. The other thing it does is going back to eighth grade biology. Everybody heard about the mitochondria, the powerhouse of your cell. The photon energy from the laser goes into your mitochondria and hits something called your chromophore. It's like a photosensitive receptor, and it allows for more ATP production. What's ATP? Adenosine triphosphate, and that's your cellular energy. So basically, all that means is you're going to help create and replicate newer and healthier cells, and in turn, your damaged cells are going to kind of get weeded out. So almost every patient I have in there, I do use the class 4 therapeutic laser just because the results we're getting is crazy. She's not here today, but if you guys stop in, you got to ask the front office about the woman who came in with a walker and we lasered her knee twice. She actually fractured her kneecap, and she walked out of here Monday without a walker after just 2 treatments from the laser. That's pretty crazy stuff. You can't make that up, and that just speaks to the volume what the laser does. So we'll heat the tissue up. And the cool thing about that laser is, since it's so powerful, the only byproduct is heat. So once tissue gets heated up to around 100 degrees, it becomes a little bit more pliable or mendable. So if you're having pain in your elbow and you're like, my forearm's crazy tight after I'm done golfing, what we'll do is we'll actually laser local over that bone where all those muscles attach. And that's going to decrease the inflammation. And then we use that heat. So once that collagen gets heated to around 100 degrees, it becomes a little bit more pliable or mendable. So then when we actually do some of the muscle work, whether it's ART, whether it's Graston technique, whatever we're doing to kind of lengthen that muscle, it's just going to work a little bit more efficiently. Same principle as if you're trying to bend cold rubber as opposed to warm rubber. So same kind of principle there. Um, and just to kind of go over a couple of the motions that you're doing in the TPI screen. So when you come in, we're going to check your pelvis. So we're going to see how well your pelvis moves. That should be very, very mobile, and your lumbar spine should be stable. So one of the first things you do is you get in a setup posture, and then you actually go from your C to your S curve, and you're looking for something called perturbation. So if you start feeling shaken, so if you're in your 5-iron stance and you go from your S to your C posture and you kind of shake a little bit, that's called perturbation. Basically, all that means is you have weak core. So number one, we're going to give you the best core stability exercises to kind of engage your core, just so you could kind of link up your upper extremity to your lower extremity a little bit more efficiently during a golf swing. Next is pelvic tilt to check the kind of rotation of your pelvis. And then we go into torso rotation. So a lot of people are actually deficient in your thoracic spine rotation, which is massive. So if we take a right-handed golfer, for example, you should have very good left thoracic rotation. Excuse me, right thoracic rotation to kind of get all the way to the backswing. So I cannot kneel right now or else I'll be off screen, but one of my best like openers for any kind of thoracic mobility is, and I recommend doing this pre-round, maybe a half an hour before you go out. What you're going to do is you're actually going to kneel against the wall, and the side of the wall you're against, that knee is going to be down, and then you're actually going to be up on your foot on the other side, and you're basically just going to go up to the wall and do a thoracic extension here. And so we have just like a couple. Phil, it's kind of hard to demo these right here. It's all right. Do we have that video of the um when I was doing the open book or like anything like? Okay, don't worry about it. Yeah. So we probably have like around 6 or 7 different like thoracic rotation exercises that we could do. Again, just to kind of open up your thoracic spine so when you're swinging a golf club. Oh yeah, you can even check Instagram too. We have them on the World of Wellness Instagram, and then my personal one's Dr. Phil Ross, and we definitely have some like lumbar support things. We have some different stretches, and yeah, so the Instagram is actually a really good tool to kind of just see what we do in here. Phil did a heck of a job actually. We did a really good video I think on lateral epicondylitis, the tennis elbow. How we were talking about, even though golfer's elbow is the inside, a lot of people still have pain on the outside of their elbow as well. So yeah, if you want to look on Instagram, you basically my tag is at Dr. Phil Ross, and we basically go through a couple different stretches and exercises you could do and that you could incorporate into your golf game. We check hamstring, we check shoulders. A lot of people are deficient in their range of motion and mobility of their shoulders. Where that hits home to me, actually, I had 2 shoulder surgeries prior. So my shoulder's been messed up for a while. And it is, I feel the most competent treating that, just any kind of tightness in shoulders. Again, there's different stretches we could give you, and then there's different exercises that you could do to engage certain muscles that will kind of help stabilize your shoulder. Um, yeah, so that is the TPI in a nutshell. So again, that's one of my favorite things to do just because it's really fun to hear people coming in and they were like, "Yeah, I went golfing and I feel like my drive's going maybe 10 yards further than it was a couple weeks ago." Or, "Hey, I went and played 18 holes and I didn't even worry about my knee or my wrist didn't bother me whatsoever." So, um, you don't have to be a professional golfer to get screened. If you just even like golfing like once a month, it does not hurt to come in, and so we could take you through this thorough examination, and then we'll give you a printout of where you were proficient in movements, where you're deficient in movements, and then we'll give you a printout of the exercises that you could do at home, and then the stretches you could do at home as well. So the whole thing is basically to prevent injury, facilitate the tissues that need facilitated, just so you could swing exactly how you want. So again, there is not a perfect way to swing a golf club. If you watch on Sunday, if you watch the tour, everybody's different. Scotty Scheffler's feet are crazy. John Rahm, the club foot, so he's a little bit different in his swing too. His is very short, compact, and fast. That there's no cookie cutter approach to it. That's why it's vital that you actually get the screen to see what muscles function properly, what muscles need to get a little bit more mobile, and the stability structure. So we were talking about how your foot needs to be stable, lumbar spine needs to be stable, your scapular thoracic joint needs to be stable. If you're unstable there, what we're going to do is we're going to basically prime and cue those movements in the treatment room, and then we're going to give you things you could do at home. Not golfing or pre-round, just to kind of prime everything so you could swing how you want, what is right for you. So that is the TPI in a nutshell. If anybody has any questions, feel free to call. I'll talk to you over my lunch break. My lunch is every day from 1 to 2. So give us a call and we could talk about it. Come in and get screened because you cannot feel worse after this. And I think everybody's pretty surprised because they're thinking you're just taking me through a movement screen. But what we give you to do pre and post round at home, you're just going to feel way better in your own skin, and you're actually going to get a little bit more distance out of your golf game just because we're basically lengthening muscles that need to be a little bit longer, and we are basically stabilizing the structures that need to be stable in a golf swing. So that is my TPI spiel. So if anybody has any questions, call in and